being over the top. They're just supplying really high, strict guidelines because they're just trying to keep everybody safe.
More and more businesses are reopening in North Carolina, and people are going back to work. And for families, that means they need childcare. Beginning today, the state is reporting clusters of COVID-19 in licensed daycares and schools. Right now, there are 3 in our state. New at 11, Maggie Newland is digging deeper and spoke with the director of a local daycare about the process of keeping kids safe during a pandemic. Maggie.
Angela, here at the Goddard School in North Raleigh, you can see the signs right at the entrance talking about social distancing and practicing the 3 W's. They're just a couple of the ways this facility is trying to keep kids from getting sick.
Tiffany Tippin's gotten used to wearing a mask when she picks her son Wyatt up from the Goddard School in North Raleigh.
We actually just started him back in daycare about 2 weeks ago. And that was actually after talking to his pediatrician.
Daycare looks a little different these days.
There's someone that does temperature checks, and so they have questions as well that they need to answer, symptoms that they could have had or family members have had.
The state has given extensive guidance to child care centers, issuing both safety requirements and recommendations.
The new rules are very strict.
Director Robin Fuller says that's a good thing. Teachers emphasize even more than usual the importance of good hand washing and minimize contact between groups of children.
They go in and out from their classroom without, crossing paths with other classrooms.
They haven't had any cases of COVID-19 here, but state health officials will now publicize which child care facilities and schools have clusters of cases.
And we are starting to see more spread in settings that involve our kids.
I think it's important for families to know what's going on.
Fuller says it's also important to know how facilities are responding.
It doesn't mean that centers can't still be safe after something like that.
If there ever is a case of COVID-19 here, staff will work directly with the health department.
So we would follow their guidelines to a T. So whatever they advised us to do at that particular time, we would do.
For now, Tiffany Tippin says she's about as comfortable as a parent can be in the middle of a pandemic.
Some concern, but also, I think for his own good and whatnot, it's been really important for him to be back at school.
I just checked the state DHHS website. It doesn't look like they have updated the numbers just yet as to which daycare facilities in our state are experiencing clusters of COVID cases, but they do plan to update this twice a week. Live in Raleigh, Maggie Newland, CBS 17 News.